We're going to talk about hair transplantation today, specifically the different ways in which it can be performed, as there are multiple ways that you can perform a hair transplantation surgery, and which way is best for you is going to be dependent on a number of factors. I'm Blake Brooks. I'm a board-certified dermatologist and hair restoration specialist, and welcome to Derm and Donuts. This is a series of videos that I put together to answer commonly asked questions in my clinic in an easily digestible format that you can take in with your morning coffee. So let's get into it. So there's two main types of hair transplantation surgery. There's FUE, follicular unit extraction, and there's FUT. What differs in these two types of surgeries is how the hair that is going to be transplanted is harvested. So for FUT, what that essentially is sometimes called as like the strip technique. What we do is you have to shave a small area, like a strip or a line on the back of the head, and then you excise that strip of hair, and then or a strip of scalp actually, and then you sew the area back together. So what you end up with is a long linear scar that often tracks kind of right if you were to take your finger and run it like right along the top of your ear across to the other top of your other ear. That's about where it goes. How wide that is will depend on how much hair needs to be transplanted to get the coverage that you're looking for, and that's dependent in some ways on how much hair you've lost here. It's also going to depend on the density of your donor area. So where you excise that strip from, we call that the donor area. That's the hair that's going to be transplanted. People have different densities back there. Sometimes people have really light density, in which case, to get the number of hairs we need, we have to take more. And some people have a lot of density, and then we can take less. So there's a number of factors that do come into play in terms of how long that scar will be. And that's something that you can discuss with your surgeon, and they should be able to give you a rough estimate of based on your consultation. When you have FUT, again, you're going to have a long linear scar. Now, you never get away from scars. Anybody who tells you there is a scarless form of hair transplantation surgery, run out the door. They are lying to you. But you get a long linear scar in this instance. People who are good candidates for this would be people who wear their hair longer. So men who wear their hair in a longer fashion, and certainly women. And the reason why is because the other type of transplantation surgery, FUE, follicular unit extraction, what has to happen is you need to basically shave a large swath of the back of the head. So for my female patients, that's oftentimes something that's not palatable. For my male patients, if they wear their hair short, it might be better, and I'll explain why. For follicular unit extraction, what's happening is either via a robot. There's actually a big robot that can do this, where you're kind of strapped into a machine and the robot does much of the work with the hair restoration specialist or physician kind of guiding the process. Or it can be done with a manual device. Either way, the outcome is kind of the same. You're using a very small, what's called a punch biopsy. So it almost looks like a small, very, very small, like 1 millimeter metal cylinder that is hollow in the center, and it kind of punches down around the individual follicular units and takes them out. So, whereas the strip, you're taking out a big swath of hair, and then all of those follicular units need to be dissected outside of the room or in the back of the room under the microscope. With FUE, or follicular unit extraction, you're basically, at the time that you're taking them out, you're taking out the individual follicular units. That doesn't mean that there's not more processing that happens under the microscope. We have really skilled specialists who kind of make sure that every single one that is taken out is as nicely trimmed as possible. And sometimes we're cutting them up too, which I'll explain. But essentially, you're going to be taking out little biopsies or little tiny areas from the scalp. What that means is you can't take them out right next to each other because we're not cutting the skin out. If I were to sit and do this on all of the hairs within a strip, without taking the strip, you would have an area that it was completely devoid of hair, which is not a good outcome. So what you do is you have to shave the whole back of the head because you have to space those out. What you ultimately get is kind of these little white dot scars, almost like a peppering of these white tiny dots. If you are a man who wears your hair short, that's a better scar to have than a long linear scar because it's much less visible. It is there, but if your hair is even a little bit long, you usually can't see it that well, assuming that you haven't been over harvested, meaning that you are with somebody who knows what they are doing and they are not taking so much that you have little bald patches, which can happen if you go to somebody who is not skilled. In terms of, I mentioned there was a robot and then there's the little manual device. Which one is better for you is going to be dependent on basically your preference. So the robot, you are strapped in pretty tightly in order to get the tension necessary for the robot to work. Where I've seen people tolerate hair transplantation surgery a little bit less tends to be with the robot if they're somebody who is more on the claustrophobic side, because you're kind of down and you can think about it almost like a massage table type of situation where your face is down and you are strapped down pretty tight. For FUE, where it's done with the manual extractor, you aren't strapped down, but you are face down for a while. And I would say you're face down for longer with the FUE technique than the strip or the FUT technique. So there's a bunch of things that might come into play in terms of what is better for you. There's also pricing. Different places might price these procedures differently, and that can range from a different price for the robot versus manual FUE versus FUT. So make sure to talk to wherever you go about that. The other thing to keep in mind is that some places that are not doing hair restoration surgeries on a regular basis or are doing them in a different way might say that there is only one way that they do it, and that is the best. And certainly for some patients, one way might be the best, but there is no one way that is best for all. So make sure you go to a place where they are offering multiple different types of hair transplantation surgery, because that shows you that they're really doing it every day and they're going to give you the best option for you. Now, in terms of the rest of the surgery, meaning how those are placed, that's a really kind of interesting question too. And I think that I'll cover that in a separate video just because it kind of tells you the difference between modern hair transplantation surgery and plugs. But look out for that, and we'll talk about how those are placed and what you can expect after the surgery. Okay, I hope you enjoyed Derm and Donuts, and have a great day.